cease to tarry, and the trumpet sound. Oh, we see the gleams of the golden morning, piercing through this night of gloom. Oh, we see the gleams of the golden morning that will burst the tomb. Attended by all the shining angels down the flaming sky. The judge will come and will take his people where they will not die. Oh, we see the gleams of the golden morning piercing through this night of gloom. Oh, we see gleams of the golden morning that will burst the tomb. There those loved ones who have long been parted will all meet that day. The tears of those who are broken hearted will be wiped away. Oh, we see the gleams of the golden morning piercing through this night of gloom. Oh, we see the gleams of the golden morning that will burst the tomb.
All right, thank you so much, Brother Davis, for pitching in. All right, you can hear me and see my screen as well?
Much better now, yes, everything is good.
Awesome. All right.
We're not seeing your video though, but everything is fine.
Pardon?
We're not seeing your video though, but everything is good.
Really? Oh, my video is on. Okay, seeing me now?
Yes, we are seeing your beautiful face.
Yes.
Happy Sabbath.
Happy Sabbath, everybody. Thank you for your patience. I'm not so familiar with technology, but hey. All right, so today we'll be looking at a very interesting topic, which I find very interesting. The production of life, or I should say conception and so forth. The female reproductive system. All right. Are you seeing the screen?
Yes, we are.
Okay, awesome. All right. So the female genital and reproductive system includes both internal and external or genital organs. The internal genitalia is in the pelvic cavity, includes the ovaries, the uterine tubes, uterus, and the vagina. The external, the majora and minora, the clitoris, and the vaginal introitus, that should be VA, sorry. The breast or mammary glands also play a role in the female reproductive system. The female reproductive system, together with the urinary system, is known as the genitourinary system. Because I mean, the urinary system also is involved with the female reproductive system. So the function of the female genital and reproductive system is to secrete female hormones, develop the female secondary sexual characteristics, produce eggs, menstruate, conceive and bear children, and produce milk to nourish them. Right? So let's look at the ovaries. An ovary is a small egg shaped gland about 2 inches in length near the end of a uterine tube. The ovaries are held in place by a broad ligament a folded sheet of peritoneum that extends to the wall of the pelvic cavity and by other ligaments. So I mean it don't fall down. What is happening here? Where's my screen? Oh, so the ovaries are the gonads or sex glands in a female. They function as part of both the reproductive and the endocrine system because they secrete hormones, right? So that's why they're also involved in the endocrine system. The ovaries contains follicles that rupture, releasing an egg during the menstrual cycle. The ovaries are glands that secrete 3 hormones: estradiol, progesterone, and testosterone that affect puberty, menstruation, and pregnancy. Yes, the female, the eggs release testosterone. So the uterine tubes, each tube is about 5 inches long in length and is placed by the broad ligaments. The function of the uterine tube is to transport an ovum from the ovary to the fetus. Its medial end is connected to the uterus, but its lateral end is not connected to the ovary. There is an open space between each ovary where an ovum is released. There is a thing called fimbriae, which is a moving finger-like projection at the end of the uterine tube, which create currents that carry the ovum into the funnel-shaped part of the tube and then into the lumen of the tube. So it's like peristalsis in the gastrointestinal tract, where it moves the food or particles into the digestive tract to prevent it from going back upwards, right? So there is the cilia, which are tiny hairs beating waves like peristalsis propels the ovum towards the uterus. Fluid inside the uterine tube contains nutrients to nourish the ovum on its 3-day journey to the uterus. I mean, it's not really a long space between the ovary and the uterus, but it takes 3 days for the head to reach there. The uterine tube is also known as the oviduct. It's another name for it. Together, the ovaries and the uterine tube is known as the adnexia. Everybody here following? No question? Okay. I see a lot of females are on. Awesome. All right, so let's look at the uterus. The uterus is held in place by the broad ligament and other ligaments that go from the uterus's side of the pelvic walls and the bony sacrum, which is the end of the spinal column. The broad ligaments creates a small pouch, the cul-de-sac, between the uterus and the rectum. The body of the uterus is the widest part, and it narrows and becomes the cervix, which is the neck of the uterus at the very end. The cervical OS in the center of the cervix is the opening of the cervical canal. The wall of the uterus is composed of 3 layers: the perimetrium, the myometrium, and the endometrium. The perimetrium is the outer layer. It is a serous membrane that is part of the peritoneum that lines the abdominal pelvic cavity. And the myometrium or uterine muscles contain smooth muscle fibers that are oriented in different directions. This allows the uterus to contract strongly from side to side during labor and delivering of baby. And the innermost layer is the endometrium, which lines the intrauterine cavity. It is a mucous membrane that contains glands, and this layer thickens during the menstrual cycle. If an ovum is not fertilized, this lining is shed during menstruation. Okay, let's tap the next. Okay. The vagina is about the vagina. This is about 3 inches long. Within the vagina is the opening canal. At the inferior end of the canal is the hymen, which is an elastic membrane that partially or completely covers the opening. Although it is sometimes absent, the hymen is is easily torn. If present, it is easily torn by insertion of tampon, examination when you go to the gynecologist, or intercourse. So there are other things that can also break. Hymen is very thin, so it easily breaks. The breast or mammary glands are located on the chest. They contain adipose or fatty tissue and glands. The breasts develop at puberty in response to estradiol secreted by the ovaries. They also provide milk to nourish newborn after birth. The breast contains lactiferous lobules that produce milk, and milk flows through the ducts to the nipples. And the areola, which is the dark area around nipples, have some kind of like bumps around it, some high, you know what I'm talking about. They secrete oil to protect the nipple when the baby is feeding. Okay. Moving quickly, I'm running out of time. All right, so let us look at maturity and so forth. At the onset of puberty, the anterior pituitary gland in the brain begins to secrete 2 hormones that stimulate the ovaries. FSH, which is a follicle stimulating hormone, stimulates the follicle in the ovary to enlarge and produce a mature ovum. Like a spermatozoon, the mature ovum is created by mitosis and meiosis. And like a spermatozoa, the mature ovum is a gamete. However, unlike spermatozoa, only a single large ovum is produced, unlike the sperm where a lot of them. It contains 23 chromosomes, and the remaining chromosomes are discarded in small pockets of cytoplasm known as polar bodies. So FSH also stimulates the follicle to secrete estradiol, which causes the development of the sexual characteristic. And then LH, which is luteinizing, which stimulates a single follicle each month to rupture and release the mature ovum. Then it stimulates centelminal. What are the 3 hormones that the ovaries secretes? Hello, is everybody hearing me?
Progesterone, estrogen, and maybe testosterone.
LH and FSH. I don't respond.
I wasn't here. That person was breaking up. So like
It's a 3, FSH and LH.
it was mentioned.
Not hearing me?
Yes, I'm hearing you
It
now.
was mentioned?
Yes, it was. Okay. All right. So the first one is
Yes, I'm saying I remember LH and FSH, but I don't remember the other one. Estradiol, progesterone, and testosterone, you're saying?
Right.
Okay.
Right. So estradiol is the most abundant and most biologically active in female hormones. It is secreted by each follicle. This causes development of the female characteristics during puberty, which is enlargement of the external genitalia, development of the breast, widening of the pelvis, growth of pubic hair, and sexual drive. So this is what estradiol does. And it also causes the endometrium to thicken during the menstrual cycle. And this is also secreted by the placenta during pregnancy. Things is happening. Yes, dear.
So what about what we're seeing now, where some men are developing those characteristics? Like you have men who look like they're very effeminate in their body structure. Is it a hormone issue?
Yes. Because even some females, like they have too much testosterone levels. Hence why there is imbalance of hormones and so forth, and it's an issue. So we need to balance back the hormones. Well, in most cases, it is hormones or practices. So progesterone is secreted by the ruptured follicle after ovulation. And this also causes the endometrium to thicken. So both the estradiol and the progesterone causes the endometrium to thicken. It is also secreted by the placenta during pregnancy. And there's testosterone, which is a male hormone secreted by a cell around the follicle. It plays a role in the female sexual drive as well. How much time do I have? I have about 3 slides left, or 4. Okay. So the
Can go to 5 past.
and the time.
10, but you can go to 5 past.
Okay. Thank you. All right. So oh, so hello.
Happy Sabbath. Sister She's here. Before you go on to the menstrual cycle, I'm not sure if you will cover it, but I realized that a lot of females are having multiple miscarriages. Sometimes they have miscarriage, but they don't know because it is miscarried within the first 6 weeks of pregnancy. So it would kind of come off like a period, right? But I realized that, as you said before, in regards to progesterone and hormonal imbalance, most times it's hormonal imbalance, especially when feeding on like the chicken and so, where they push hormones in, as well as soy products, because soy products has phytoestrogen, and those phytoestrogen, as you had said, that the estrogen allow the lining of the wall to thin, right? Progesterone thickens the lining, estrogen thins the lining. So with that added estrogen from soy, even GMO, soy on a whole, it causes the lining which the egg would need to attach to. It causes the lining to break down. So you realize, because of meat eating as well as soy products, especially GMOs, you have a lot of miscarriages now, and females don't know what is causing it, but this is one of the many reasons. Mr. Sashwar?
Actually get stuck.
Oh.
No.
She has fallen on.
I am back.
Welcome.
Okay, awesome. All right, so the menstrual cycle, going to have a little look at that. With the onset of puberty, the female begins to ovulate and menstruate. Are you hearing me?
Yes, we are hearing you now.
Yes, we can hear you.
All right. So menarche is the beginning of menstruation, which occurs with the first period, right? So that's the very first that you receive during puberty. So each cycle on average lasts 28 days and include 4 phases. The menstrual phase, the proliferative phase, which is followed by ovulation, the secretory phase, and the ischemic phase, right? Why is it not nesting? All right, so the menstrual phase is from day 1 to 6. Some people last more or less, but on regular, it's supposed to be from 6 days to 7 days, right? Menstrual begins approximately 30 milliliters of blood. Endometrial tissues and mucus is shed from the uterus and passes through the vagina. All that remains of the endometrium is a thin layer of glands. At the same time, several follicles in the ovaries are enlarging and their ova are maturing in preparation for one of them to be released during ovulation day. So meanwhile, you're menstruating, things are happening, waiting for the next period, right? And then there is the proliferative phase, which is day 7 to 13. The FSH, follicle stimulating hormone from the anterior pituitary gland, stimulates the ovarian follicles to secrete estradiol. One follicle becomes greatly enlarged and produces a mature ovum. And the endometrium in the uterus becomes thicker. And at the end of the proliferative phase, mucus in the cervical canal thins to allow sperms to pass through it. So anybody, females, do you have the calendar app? That's the period calendar app. You'll see where it says at some point, low chance of pregnancy or high chances of pregnancy. I'm not sure if you see that.
Yes.
Right. Yes.
Yes, I don't have the app, but yes, I understand.
Okay. So, so at this point, the very high chance of pregnancy when the canal thins and the mucus thins and allow. So that's where things can happen. Okay. Ovulation, is where it's a very high chance, which is the most highest chance for you to get pregnant. Right. So FSLH, I should say, causes the enlarged ovarian follicles to rupture, releasing a mature ovum. The basal body temperature or baseline rises to about 0.4 degrees at the time of ovulation and stays elevated until the onset of menstruation. So at this point, people feel all sorts of ways.
Yes, Sister Sashoy, one of the methods that, persons, especially persons who don't want to be on birth control with all of its side effects is the calendar method, as you were talking about now, as well as the temperature method. And the temperature method, as you mentioned, the rise in the temperature, yes, you feel a little feverish around that time, the time of ovulation. So Females especially, well, we know that, hey, you know, not to do anything much on that around that time. Yeah. So the
Unless-
temperature is yeah, a good marker.
Right. So the secretory phase, day 15 to 26. So the ruptured ovarian follicles fill with yellow fat and becomes the corpus luteum. This secrete estradiol and progesterone causes the endometrial glands to enlarge and the endometrium becomes thicker. Small arteries grow to the inner edge of the endometrium, ready to nourish a fertilized ovum, and the basal body temperature continues to elevate due to progesterone. That was supposed to be a full stop. So nothing happens during that time, the ovulation days, just get rid of itself, yeah? Because everything is ready, nutrients, all these things ready to take place. All right, so
And Sister Sashoy, just wanted to add as well that around the time of menstruation, like within that 1 to 6 days, unfortunately, a lot of females experience a lot of pain, as well as they experience bleeding in other areas, rectal bleeding, sometimes bleeding in the lung. And that is because there is this condition called endometriosis. And sometimes the cell, as I just mentioned it because you're talking about the endometrium and the blood flow, the tissues and all of these things. So at that time, the time of menstruation, because of the change in hormones, the hormones change and the thickening, the tissues in the rectal area, sometimes the tissues migrate to the rectal area, sometimes in the lungs, sometimes other places. And during the time of menstruation, it breaks down the same way. I remember Kenny was sharing an experience where the lady has endometriosis and he literally had to drain a lot of blood, right, Kenny? Out of her lungs. Yes, because she has endometriotic tissue in her lungs. So just wanted to say that sometimes if you hear any lady explaining or just talking about bleeding in other areas, especially during that time, you can let them know that it may be endometriosis. And the first line of treatment is to get off meat. Yeah.
To get a what?
To get off meat.
Oh.
And yeah.
All right, thank
So
you.
Sister Shrees, excuse me. Sister Shrees.
Yes, brother.
If she's bleeding in her lung, how she identifies that and how she deal with it? If the lady is bleeding in her lung, how she identify the bleeding and how she deal with it? Was she have shortness of breath or what?
Yes, man. They have respiratory distress of some sort. They can't breathe or pain breathing, or they just feel uneasy and pressure. And so they're normally coming for like a chest X-ray.
Okay.
And a chest X-ray will show something which at the base of your lungs, it should be sharp, meaning nothing should be there. But when if it's pleural,
if it's circular,
plural, if it's
blood.
straight, yes, it could be pleural effusion, or it could be blood. It could be a hemothorax. Okay, but what causes the hemothorax? Is it bleeding inside the lungs, and what is the bleeding from? So it was when we did that procedure.
It's on endometrial cell.
Yeah, so endometriosis is where the lung, the uterine tissue, the endometrium grows elsewhere besides the uterus.
And you normally get those effects during the menstrual
Yeah,
period, because
especially.
that's when the tissues break down
Mhm.
naturally.
Yeah.
Mhm.
So it looks like a monthly suffering for this person.
It's an ongoing.
Oh, it's
Or it's a
ongoing.
build up that you deal with after a period of time.
Yeah, it's monthly. Yeah.
Wow. Wow.
Lots of vaccination. Okay. Time is, yes.
Yeah.
I just last slide.
Okay.
I'll wrap up here. Yes. So the day 27 to 28, so the corpus luteum turns into a white scar tissue, which is corpus albicans, and stops secreting estradiol and progesterone. So the abrupt decrease in these hormones causes the small arteries in the endometrium to contract. This stops the flow of blood and causes ischemia of the tissue, and the endometrium begins to salt off and menstruation begins again. Right? All right. Oh, yeah, this is the last slide. So conception, we'll look into that story. Can I just read this last slide? Okay.
Go ahead.
Of the 100 million.
Go ahead.
Okay. Of the 100 to 500 million spermatozoa deposited during coitus, only some are able to reach the ovum. This occurs 24 to 48 hours after intercourse, and chemicals secreted by the ovum attract the spermatozoa, and a cap-like layer of enzyme on the head of each spermatozoon begins to dissolve the layer of cells around the ovum. And many spermatozoa attached to the ovum, but only one penetrates its surface. And this is the moment of fertilization. So we will continue some other time with other stuff, birth and so forth. But we will end here. I thank you all for your participation. And I will see you guys next time with more information. Okay.
Thank you very much.
I will not be host. You're welcome. Males.
Thanks. Sister Sashoy, for bringing to us the health focus. I'm reminded about a lot of things. Things that as if I've forgotten a lot. But thank you for refreshing our mind. At this time, we move straight into our musical item. Give Me the Bible. I think that is 272. Pastor? Pastor on?
Two 272. Give me the Bible, star of gladness gleaming, to cheer the wanderer, lone and tempest tossed. No storm can hide that peaceful radiance beaming, since Jesus came to seek and save the lost. Give me the Bible, holy message shining. Thy light shall guide me in the narrow way. Precepts and promise, law and love combining. till night shall vanish in eternal day. Give me the Bible when my heart is broken, when sin and grief have filled my soul with fear. Give me the precious words by Jesus spoken. Hold up his lamp to through my Savior near. Give me the Bible, holy message shining. Thy light shall guide me in the narrow way. Precepts and promise, law and love combining, till night shall vanish in eternal day. Give me the Bible, all my steps and light,